The CDC recommends women who are trying to get pregnant be up to date on their immunizations. But what about vaccines during pregnancy? Dr. Janice Naumann from Randolph OBGYN joins us now with more on that. Dr. Naumann, it's great to have you here. Thank you so much.
Thanks for having me.
Thanks for being here. Okay, let's start because 'tis the season for the flu and flu vaccines. When you are pregnant, when a woman is pregnant, can she get a flu vaccine?
Absolutely, and she should. Absolutely. People are at higher risk for having the flu when they're pregnant, and they're also at higher risk for having really serious complications like pneumonia. So it's really a great idea to do that.
So no risks involved with that, anything like that?
As long as it's the inactivated vaccine, they're absolutely fine. They just cannot receive the live vaccine during pregnancy.
Okay. What about the Tdap during pregnancy?
That's a good question.
Tell us what that is.
Good question. That actually refers to a vaccine that vaccinates against tetanus, diphtheria, and pertussis. And pertussis is the big one that we're hearing a lot about because that's what we know as whooping cough. And in the past, we've been vaccinating patients right after they've delivered. Unfortunately, we realize there's a window of time before they develop antibodies, and their babies cannot be vaccinated for pertussis right away. So now the CDC recommends vaccinating pregnant women after 20 weeks, and that's a change over the last year or so.
Okay, are there any safety concerns with that one?
Really not, as long as it's received after about 20 weeks, because there's no live vaccine involved there.
Okay. What other vaccines should be considered during pregnancy?
That's a really good question. Anyone who is in a healthcare field needs to be updated on hepatitis B specifically. And most people have received that vaccine if they're 30 years old or younger. But if someone is starting their clinical rotations as a nurse and she's 34 and pregnant, if she hasn't been vaccinated for Hep B, we would recommend doing that even during a pregnancy. And that's not a live vaccine, so it's okay to do.
Okay. Again, that seems to be the key. If it's not a live vaccine?
That is the key.
Okay. That's what we're concerned with. What about during breastfeeding? Vaccines during breastfeeding. I remember being so worried about anything that I took into my body during those days. What about those concerns? There's
actually really good data on that there's very little of the vaccine that goes into breast milk. So live vaccines and killed vaccines, all of those vaccines should be safe for breastfeeding. There are only two that you cannot use during breastfeeding, and they would be really rare vaccines: yellow fever and smallpox. So those are unusual.
What about for women who are trying to get pregnant? They're not pregnant yet, they're just trying to get pregnant, they're thinking about getting pregnant. What should they be concerned about?
That's a really good question. One of the things we really like our patients to do is make sure that they're updated on their German measles vaccine. That's called rubella. That is a live vaccine, so we don't want people to receive it during pregnancy. So it's great to know that you're updated on that before you get pregnant. I think other than that, chickenpox is probably the other one, the varicella vaccine. And that's another live vaccine, so if patients can be vaccinated before they get pregnant, that would be perfect.
Okay, Dr. Janice Naumann, thank you so much. Randolph OBGYN has 3 locations. You can find Dr. Naumann at the Randolph Road location in Charlotte. To reach that office and the office at the Epicenter, call the number on your screen. It is 704-333-4104. Again, the top number there on your screen, 704-333-4104. You can also call the office they have in Cornelius. That number is 704-895-7224. Again, 704-895-7224. Dr. Janice Naumann from Randolph OBGYN, thank you very much.
Thank you.
Appreciate it.